all of that stuff comes into play. And you were talking about all those factors, and that, when we're encountering someone who's in crisis, all of that, all of the experiences that they've had, and the things that are happening to make this situation be happening at that moment, it all comes into play. And then those are the things that we have to deal with and stuff. I think that, our training has gotten so much better over the years. Kevin, what you were going through years ago, I've always thought we've had good training, but it just keeps getting better and better. And the ability to send people to get specialized training. The CIT program has been tremendous. We keep getting more and more officers that have had that training, and then we've been able to send a lot of supervisors as well. And then here recently, the co-responder program, it wasn't anything that I ever dreamed that we would have, when we were starting out years ago. And Bryn has been tremendous, and Pawnee's been tremendous to work with, and having a familiar face and having that resource to come out, and even sometimes, to talk to them on the phone and have access to resources and advice on how to handle things, and having someone that we can trust to help us make good decisions when someone's in crisis. And then having, so the thing that we always struggled with was we were dealing with things, and we would try to put out fires and deal with just the problem that we were dealing with at that moment, and in that call and that night. And Bryn and the program is so good for doing follow-up, things that we weren't very, we've struggled with over the years, but they have that ability to do follow-up and make sure that people are getting help when they need it, and resources and stuff like that. And there's been so many instances where they've been able to do things to make it so that, repeat folks that we in the past would have dealt with again and again and again, they're able to, on the front end, divert those calls to, I'm not saying that they go away, but they're taking care of them. And then you've got their professionals, dealing with, instead of police officers, and especially when it's different police officer every time, and having to start from square one, they're taking a huge burden off of us whenever they can. So it's been a great program.
So I've been with Riley County for a little over 3 years at this point. Oh man, when's the last time I ran stats? 2018. Yeah, 2018 we were looking at man, I don't have it perfect, but we had at least 1,100 calls for service for the co-responders. So it's not necessarily that was a call that we responded to, but it's some sort of interaction that the co-responders did, whether that was on scene, follow-up, or any of those sort of situations. That's changed dramatically in the past year. So if we wanted to do an actual breakdown, I could get you the numbers of what it's looked like from 2017 to current, on what that entails. But kind of what Captain Steer, sorry, I keep wanting to call you LT,
yeah, no
problem. Was mentioning about is, I don't see a difference on the different type of calls that we deal with, and how we interact with them, regardless of the situation. They all handle it professionally. They all do what they need to do. There's no lack of service because of certain situations. I'd say the only downfall that comes sometimes is the socioeconomic status. If they have insurance, if they have income, because that limits their treatment options or our options of where to go at that point. Because if we're wanting that person to go to the ER, if they don't have insurance, they're fighting us because they don't want to go to the ER. The stabilization unit has helped with that some, but then you also have other things. So if we're dealing with somebody that's experiencing homelessness, it's really easy for us to get them hooked up to the right place. But if they have no income, they have no money, any of that kind of stuff, then we're calling around and having to find funds and all of those sorts of things. So I'd say that has the biggest impact. I don't come from a law enforcement background, so my first day on the job was probably the most most positive experience that I've ever had with law enforcement in my entire life. Because prior to that, it wasn't always great experiences. But I mean, they've been a great group of guys from day one. Absolutely. There's never been an experience or a call where I've felt uncomfortable or felt like we weren't doing a good job. Is there times where we're all upset because we have no options? Absolutely. And I think that's been consistent from day one. I don't feel like, in my personal opinion, I don't feel like we've ever done anything to the detriment of somebody, unless there was no other options, talking like arrests or something like that. More times than not, that's not our goal. Especially if somebody's in a mental health crisis, substance use crisis, or any sort of crisis in general. Our number one priority is to get them help. And then sometimes it comes with the only way to fix the current situation is that somebody's getting arrested. To at least get them out of the situation that they're experiencing right then.
I've had various experiences over a very long time, going back to the early 1980s, with the system in general, not the law enforcement system, but the whole social services system. And actually, I guess I'd have to say that my experiences with law enforcement have been perhaps better than those with the rest of the system, because maybe I don't see them as often, although I've seen them often enough. One year they said, "You got to do something about this kid because we've been here 11 times and this is getting kind of tiresome." And I couldn't disagree with them, but at the same time, there was not any system for assistance when a kid in crisis from PTSD and who knows how many different diagnoses, most of which are just parts of PTSD, was going out of control. And we couldn't get much response out of Pawnee, which was the only service provider in town. And so we really had no alternative but to go to RCPD. And I thought they did the best they could with what they had to work with, but they didn't have much to work with, a lot of the guys, in the way of training. And a couple times they went beyond what you would hope for. On the day my mother died, the kid lost his mind. We're not exactly sure why or how, but he geared up in armor to go out and save the world from alien invaders, essentially, and was going down a road, and we had called the police and they followed along. And one guy, I guess, got impatient with him when he wouldn't follow instructions. But when you're defending against space invaders, you don't necessarily follow instructions from ordinary mortals. And so the guy ran out of patience and tackled him and took him to the ground and handcuffed him and, threatened to do more with him. But then a neighbor of ours came along and was able to talk him down and walk him home. So different approaches work differently with kids in that kind of a situation. And the officer who did it was a guy who was approaching retirement and obviously had not trained in what developmental trauma and fetal alcohol syndrome do to the brain of a kid that leads, and neglect along the way, leads to this kind of behaviors. I think people are catching on more, but it takes more than just a little training to really get good at dealing with it. And I think other folks here could talk about that more than I ought to, because I know you've got a lot of things on your plate when you're trying to police a whole town for a lot of different things. But when 1% of our population is kids with fetal alcohol, maybe more, and that knocks a big hole into their, what you'd call executive function, so they can't control impulses. And if they've been abused or sexually abused in particular, they have a lot of fears and hostility. And you might think that they're attacking you, but in fact, what they're doing is trying to defend their own lives.